yours. A big thank you. A figure of strength like a true cashew. Your work dynasty saving life fearlessly. I dedicated this line to all the dignitaries present among us. I, Fazan Sayyed, the host for the evening, feel very pleasure to welcome you all to the prestigious webinar. This webinar is designed to enhance and appreciate some wonderful personalities in the field of healthcare. Gautam Buddha has said, to keep the body in good health is a duty. Otherwise, we shall not be able to keep our minds strong and clear. You all are the one who regulate his job of maintaining proper health among us. We all know the world is suffering from very tough days, and you all are every day putting efforts, determination, and courage to eradicate the current pandemic. Not only you, but your family members look towards you like pillars. Hence, we are the Golden Aim Awards, organized by Genetic Business Solutions, for honoring you for the contribution in the field of healthcare. Once again, welcome you all to the most prestigious webinar of Golden Aim Awards for Excellence in Leadership in Healthcare. Now, I call upon Mr. Azharuddin Farooqi, CEO and co-founder of Genetic Business Solutions, to speak few words. Over to you, sir.
Good afternoon to everyone present in today's webinar. I, Azharuddin Farooqi, CEO and co-founder of Synergy Business Solutions. It's both an honor and a privilege to stand before you and welcome you all to this prestigious webinar, Golden Aim Conference and Awards for Healthcare and Leadership. Doctors are considered next to God. I express my gratitude to all the professionals present in today's webinar. And I like to thank all the physicians and healthcare professionals for your hard work and thoughtfulness, commitment during this challenging time, as they put their life on risks to serve the patient. And my company, Synergy Business Solutions, we provide solutions in various segments and sectors, such as garment business. We are in real estate, in healthcare management, and we have fitness chains. As we start our business in 2010 with a small warehouse in Mumbai, and with the team support, we build our chain national to international level. The nationally, we have chain in Mumbai, Pune, Delhi, Bengaluru, Goa, and internationally, we have Dubai, Oman, Malaysia, and Indonesia. And with the team support, hope to build more chain in future. Thank you for Golden Aim for giving us a chance to be a partner of this prestigious webinar where healthcare professionals and thought leaders share their views and knowledge. Thank you so much, and over to you, Professor.
Thank you so much, sir. Now we move on to our conference ceremony. We move on to our next respected speaker, Dr. Pradeep Kumar Rai, President, Varanasi Nephrology Society, and sir's topic is digital transformation in nephrology care. Over to you, sir.
I am thankful to Golden Aim organizing committee for inviting me for this talk. And as it is the future of nephrology, it was really a challenging talk for me. And I thought to speak on digital transformation of nephrology care. As you all know, the digital health is an area that emerges from the association between health needs and technological solutions. With the growing internet and the ease of acquiring equipment that allows the internet connection, and we are observing an exponential increase in the strategies that use the patients and the healthcare providers. As you all know that artificial intelligence is taking place in each and every field of life, and the same thing is true for medicine and nephrology also. And fourth revolution is going to take place. Are we really prepared for it? Currently, we are experiencing the fourth technological revolution, which is characterized by artificial intelligence, robotics, the Internet of Things, and 3D printing, nanotechnology, and many other tools that connect different domains, the physical, digital, and biological. Digital health is an area that emerges from the association between health needs and technological solutions. It is the coverage of digital technologies with healthcare and societies to provide personalized, tailored medicine and enhance the healthcare delivery. Today, I will be highlighting the health digital transformation in nephrology care. As you all know, chronic kidney disease is characterized by gradual renal function loss with the damage to health and development of complications, mainly cardiovascular diseases. However, its adverse results with renal failure and premature death can be prevented or delayed if adequate measures are adopted in a timely manner. The identification and referral to specialized care has been the main focus of CKD prevention because it has the potential to revert, delay, or prevent the CKD progression. Cases of CKD are growing globally as well as in India. According to the global burden of disease 2017, there were 697 million cases of CKD in the world, of which 115 million cases are from India. Estimates of prevalence of CKD was 9.1 in the world population, and CKD at different stages in stage 1 to 2 accounted for 5%, stage 3 for 3 to 9%, and stage 4 0 to 16%, and stage 5.07%. CKD prevalence of 8.7% to 16.4% has been reported in contemporary studies in India. The main challenges to overcome the burden of CKD are the lack of knowledge about the disease, adherence to therapy, timely reference, access to dialysis center, limited trained manpower, and addressing side effects of medicines by shared decision making and frequent monitoring. The limitations of digital literacy are low educational level, functional illiteracy in which one person can read but does not understand the content, difficulty to access these technologies, digitally excluded population, regulation issues are also an important part, and legal issues are also important, especially for the remote care patients. Lack of skills to use the technology also plays an important limitation effort in the digital literacy. Novel strategies and technologies applied to nephrology in recent years. The telenephrology, as you all know, from the there is one platform from where patients are connected, the doctors are connected, and from that place, the patients of nephrology, especially the dialysis patients, those who are getting hemodialysis or CAPD, can be instructed, and patients can also contact the nephrologist over there. And from that platform, the renal education also can be imparted to the patients and the caregivers. The pros and cons of telenephrology: the access to help even from remote areas, communication tools, shared decision making tools, educational tools, and prescription tools, as well as the referral, play an important part in the telenephrology. To establish a standard interoperability and extend access to a broader range of people, commercial reimbursements, government reimbursements, and credentialing, security and data privacy issues needs to be addressed. The cyber security is another issue which is limitation for the telenephrology. In telenephrology, providing healthcare to remotely located patients with chronic kidney disease has been published in American Journal of Nephrology in 2018, where the remote CKD care delivered through telenephrology improves renal clinic visits, adherence, while delivering comparable renal outcomes. Applications of this technology is a promising method to provide access to care to rural CKD patients and to minimize the disparity between urban as well as rural patients. As you can see in this, there are many applications which are applied, and it really assesses the eGFR. CKD screening is done. CKD nutrition can be education, and nutrition can be taken care of. Kidney transplant, pre-transplant workup can be educated. The medication information, as well as the patient management, monitoring of sugar, monitoring of blood pressure, can be done with the telenephrology tools. And the persons who are to be educated or to be communicated are health professionals, patients, and caregivers. And the future is also important as far as the more personalized care can be designed and tailor-made for these patients. To better understand the user behavior and needs, more applications directed to patient self-management, more tools to increase interaction between patients and health professionals, clinical trials to investigate the impact on clinical outcomes in these patients. These are, as you can see, there are many apps which have been shown, like renal health, monitoring of blood pressure, monitoring of fluid status, and patient education, which has taken place because of the telenephrology. The other softwares have been utilized in communicating and managing CKD patients and getting good treatment outcomes and reducing the mortality worldwide in these patients. Assessing the link between modified teach-back method and improvement in knowledge of medical regimen among youth with kidney transplants, the application of digital media has played a very important role. In USA, a group of researchers have shown the effectiveness of digital media educational program for kidney transplanted young patients who had improved their health literacy after participating in this activity. The social networks like Facebook, Twitter, Instagram, WhatsApp also plays very important role, and it has really become the need for every patient, every healthcare provider, and every healthcare giver to be connected via these social networks and get the better outcome in these patients. The use of these platforms is increasing, and there are estimates that approximately 72% of the US adult population use social networks, and in India also we are expecting large number of users as well. The internet connectivity plays an important role via these apps based on the YouTube channels, Instagram, Facebook, and blogs. We can educate and we can tell the healthcare professionals about, as well as the patients and caregivers, family caregivers, about the what are the needs for managing CKD patients, how can we reduce, prevent chronic kidney disease, and in future we can further enhance and take help of the digital platform in making these diseases controllable. And if the patients have developed advanced renal failure, how exactly they should proceed for renal dialysis and renal transplant, that also can be taken care of. There are three baskets in social media to support your patients. What are the patients doing online and why does it matter? Your provider SM presence, engaging with your patients online, professional development, your online reputation, resume, and peer also matters, and that needs to be taken care of. As you can see in this, when you are making a platform on digital platform, you have to use your name, your face, not the logo. Speak colloquially, not like a newspaper or a journal. Smile, and it really influences the patients and their caregivers. Be authentic while sharing information. Post information every 2 or 3 days, and whenever an important fact related to health occurs, provide our followers with updates and advice, always interacting with them and clarifying their doubts. Get smart about self-promotion. Promote yourself. Be a giver, not a taker. People like to promote them. Links, retweets, and kind words are inexpensive but enormously valuable. We should go live for some times to make them feel connected, make them feel that you are really caring for your patients. Individuals with CKD and affected others online. Share real world information, promote yourself, acknowledge challenges, vent and commiserate, motivate and cheerlead, battle misconceptions, spread awareness, create the relationship with the pharma people and healthcare workers. AI, big data, and other technological tools in nephrology, including wearable devices that measure and monitor different health parameters, are revolutionizing healthcare and the field of nephrology. digital pathology, renal biopsy reports, disease surveillance, CKD screening and management, data for risk prediction via the electronic health records, clinical decision support and management of other diseases such as acute kidney injury for its early detection and timely therapeutic intervention. And alert system should also be there so that the patient as well as those who are managing these patients are helping them to remain healthy. They should get alerts from the global platforms or from the digital platforms. As you can see in this slide, the wearable, the watches, smart watches can be helpful, and the patient can monitor his oxygen saturation by this, the sugars, the blood pressures, and these are going to be helpful in maintaining these blood sugar and blood pressure levels within normal limits. And if you are able to take care of these things, we can slow down the rate of progression of chronic kidney disease. This slide is a little bit complicated. I will not go in detail. The most advanced projects for an implantable artificial kidney seems to be the kidney project from University of California, San Francisco. And 3D printing is another interesting tool that could be used in the setting of dialysis and transplantation in the future. And it can help to decrease inequalities in the health access around the world, as patients with CKD have a 5 to 10 times higher risk to die from cardiovascular diseases than to progress to end-stage renal disease. Monitoring them through wearable becomes crucial, and it really helps in making them having a good quality life. Just to summarize my talk, the digital health is a growing area that brings solutions for both healthcare providers and patients in the field of nephrology. It facilitates access to healthcare and management of disease, including CKD, with a clear application in nephrology. Strategies already in practice include telenephrology, smartphone apps, the use of social networks, and other technologies connecting people with the healthcare team. Promising results, including better clinical outcomes and quality of life, decreased mortality, and longer survival can be seen on the horizon. Thanks a lot for patient hearing.
Thank you so much, doctor.
Thank you so much, sir. And I request team to present a thank you memento on behalf of Golden Aim team.
Now we move on to our next speaker, Dr. K. Sampath Kumar, President-elect of Asia Pacific Society of Dialysis Access, Vice President of Indian Society of Nephrology Southern Chapter, and Dr. topic is future tendencies in nephrology. Over to you, sir.
Good afternoon to all. At the outset, I would like to thank the organizers for this Golden Aim conference, and the speakers who have spoken before me are all my very good professional friends, and they have really stolen the thunder from me and made my job easier. I wanted to talk about the future trends in nephrology. So it is going to be a foreshortened one. So as you all, for the non-nephrologist, I would like to remind you that while the focus of the population at large is on the heart, there are a couple of very important technological marvels by the nature which are tucked away in the abdomen. They are the kidneys, which are doing the mighty important job of doing the chemical balancing and physiological balancing of the whole systems in the body, and yearning the Six Sigma with every passing minute. So kidney disease, has already been told, is it's an orphan disease to the extent that not many countries or not many health societies have focused their interest on that. As many as 9% of the population suffer from it, adult population, and it is threatening to overtake other diseases. It's going to become the one of the top 5 common diseases in the globally. The treatment is extremely challenging, and the enormous cost of the treatment will see to it that the other diseases are left far behind. So if you are going to focus your attention on the treatment, most of the countries are going to fail. So prevention is the key, and this is where digital technologies are going to take us forward. So as far as the prevention, the primary prevention is before diseases start. So before renal diseases start, digital technology has much to offer by promoting healthy living, food choices, promoting exercise, ensuring good water intake to those people who are in the field, because there is a large number of diseases called chronic kidney disease of undetermined origin, which are primarily directed, which are due to poor water intake. And school kidney health screening is also another important part of part and parcel of preventive technology and preventing childhood obesity. As far as the secondary prevention is concerned, you have the large two behemoths, the diabetes and high blood pressure, producing the bulk of the chronic kidney diseases. So you have the diagnostic aspect and also the controlling the diabetes aspect. All these are technologically should be tackled. So we have the hypertension, where again diagnosis and control, nephritis, specific therapies, and kidney stones, duct therapy. So in the tertiary care, we have the advanced kidney disease, where dialysis therapies, bioartificial kidneys, kidney transplantation, both human and xenotransplants, and monoclonal drugs to prevent rejection. So in our own hospital, over the last 3 years, where COVID has taken its toll, we have risen up to the challenge of reaching the unreached population. The telehealth technology has been taken to great heights from our hospital at the Meenakshi Mission Hospital. The technology is this is actually video conferencing technology, which is we have multiple areas in the Mafussil areas. And the telehealth initiatives include remote patient consults, telemonitoring of dialysis, both hemodialysis and in-center dialysis and peritoneal dialysis, telemonitoring of the renal transplant follow-up patients, the drug compliance insurance and counseling. So all these could be possible with the help of telehealth initiatives from our hospital. And so as the going gets tough, in fact, the tough gets going. So we are very happy that the telehealth technology has taken us where it was not possible, but for this pandemic, that this technology has taken great leaps. Thank you very much for this nice opportunity to interact and the award. Thank you.
Thank you so much. I request your team to present the thank you memento on behalf of Golden Name.
Thank you so much, Doctor. Now we move on to our next respected speaker, Dr. Subhasis Saha, Chairman-elect, Society of Pediatric Urology, and first topic is role of urodynamics in pediatric and pediatric surgical office practice. Over to you, sir.
So good afternoon. First of all, my greetings to Golden Aim organizers for giving us the opportunity to share our experience. And my heartiest greetings to Dr. Karl Sampath Kumar, Dr. Pradeep Rai, and all other dignitaries who spoke before me. And they actually highlighted the problem of renal failure, which is actually the biggest problem maybe for the next decade, especially as obesity and other lifestyle diseases kicks in. So as a pediatric surgeon, I would like to highlight a particular point which has been neglected for long decades. We have talked about renal transplant, we have talked about PUV, we have talked about reconstructive urology, but we have forgotten to look at the urinary bladder. Now, in our practice, we have seen that basically, since this urinary bladder was neglected, there has been we have seen patients who have undergone renal transplant at the age of 10 years, 12 years, and the donor kidneys have failed after a certain time. Why? Because nobody looked at the bladder, because the bladder was bad to begin with. Patients with myelomeningocele, neurosurgeons are happy operating the myelomeningocele and leaving them. The parents are happy. Myelomeningocele has been operated. But within a few days, within a few years, gradually the kidneys start deteriorating. So my bottom line of today's talk is the importance of urodynamics, especially as an essential tool for pediatric office practice, because pediatricians hardly ever think of urodynamics. And that's the reason why there are so few facilities dedicated for pediatric urodynamics across the country. And we are proud to hold the first position, and we have been doing since 2011. We are having dedicated pediatric urodynamics set up at our hospital, and that's probably the first one in the Eastern India. So without much introduction, let us just, why is urodynamic evaluation so important? Because we know that in our body, among all the organs, urinary bladder is the only organ which, when it's being filled with urine from the kidneys, it still maintains low pressure. Because it's common sense that any organ, when it's being filled, the pressure will increase. But in bladder, there is certain mechanisms which helps it to maintain a very low pressure even when it is being filled. So an intact neural circuit is very essential, both for the filling and voiding. That requires a delicate balance between the sphincter as well as the detrusor. And subtle changes in this circuit can cause problems in voiding. And we know that congenital anomalies of the kidney or urinary tract are there. Many children come to us with antenatally detected hydronephrosis, and those children need special evaluation for the bladder. And most important is chronic constipation. It's almost a household disease. Almost every other child is constipated nowadays because of lifestyle issues. And all these can actually affect the bladder. So what is urodynamic study actually? So it's a study of the bladder function. So bladder has two functions. One is the storage and one is the evacuation. So we study both the storage and the evacuation. And urodynamic study means a very, very hi-fi thing, not really. There are non-invasive urodynamics, as I can show you. I mean, that's just a simple bladder and stool diary. Just if the child brings with us, what is the volume of urine he passes throughout the day, if he leaks at all, and the flow of, we can look at the flow, not even in a fancy urodynamic machine. You can just look at the child peeing and we know how is the flow, whether the flow is good or the flow is interrupted, whether it is staccato or whatever it is. Then comes the role of invasive urodynamics. Of course, there is a very, very complicated neural circuit, and the intact neural circuit is very, very important in maintaining a proper balance. Because when the bladder fills, the sphincter remains tight. And the moment the bladder contracts, the moment the detrusor contracts, the sphincter must give way. If there is anything else, we have a discoordinated movement, and that leads to bladder issues. Now we know that overactive bladder is a very, very common issue, especially in the adult age group and of course in the children. Now a normal, as I've already described, a normal urinary bladder stays relaxed the whole area that over the entire time that it's being filled. An overactive bladder suddenly contracts, even with maybe 30% of filling, or maybe even 20%. It may be a small bladder, it may be a normal shaped bladder, but it's overactive. The detrusor is very much responsive, hyper reflexive. And a normal micturition also, as I've already described, it needs a proper relaxation of the pelvic floor. There are many children who come to a clinic and mothers describe that they have holding maneuvers. Whenever the children starts peeing, it holds so that, so this pelvic contraction causes a discoordination of the urinary bladder, and the urinary bladder chronically becomes thick and overactive. So these children need pelvic muscle relaxation techniques, training. So as I've already discussed, voiding diary is actually a very, very simple tool. So the entire day for 48 hours or 72 hours, you keep a record of how much urine is passing at what time and how much fluid there is intake. So we know if there is an inordinately extra fluid intake, or we know that what are the exact time when he is voiding. We may just adjust a simple thing, like we may restrict the post-evening fluid intake. That may solve a lot of nocturnal enuresis problems. So it's very important that what mind does not know, eyes cannot see. So a physician or the pediatrician has to orient his or her mind to the entire thing, that a simple uroflowmetry can actually guide you in a long way. So I'm just going through a couple of examples in our clinic. Now this 6-year-old girl, now I would like to highlight cases which are not very obvious clinically, and they can be managed. Now, this 6-year girl had 3 episodes of recurrent urinary tract infection in the last 2 months before she came to us. There is history of increased frequency of micturition, there is history of urgency, history of dysuria, and urge incontinence. And the mom says that she doesn't sense, the pant gets wet, she can't even sense urine at times. So we call it non-sensitively for 3 months. And there is associated history of constipation. So as I've already told you, there is a crosstalk between the rectum and the urinary bladder. The moment the rectum is chronically distended, the moment the child is not passing stool every day, soft stool, there is collection of stool, impaction of stool in the rectum, that directly affects the bladder. The bladder becomes irritable, the bladder may behave badly, and this uroflow tells you that it's a staccato flow. So when we do urodynamics, it shows the capacity is normal, compliance is normal, there's intermittent overactivity, and there is increased sensation. The moment the child is continually irritated till the time entire urodynamic study is done, there is no post-void residue, and Qmax is good, and the pediatric Qmax is also good. So this is the child where we can entirely manage by managing the constipation. The entire urinary infection is gone, and the child is doing well. This is another child. Now this is another area which needs orientation, because at one point of time, many reflux patients, moment the reflux patient, we can see a high-grade reflux, grade 4 reflux, bilateral. All these patients, we used to straight away go for surgery. But nowadays, we hardly ever think of surgery in a reflux patient, because we know now most of the reflux are secondary reflux. It is due to bladder issues. So if there is no, if the bladder is in a problem state, if the bladder is hyperreflexive, even if you correct this reflux with your anti-reflux surgery, it will recur again. So it's very important to evaluate thoroughly all these children before you plan surgery. So here we find a bilateral grade 4 to 5 reflux. The voiding diary is usual. And here directly your urodynamics shows severe overactivity during voiding, with pressure even reaching more than 60. So it will 100%, this surgery will fail if any pediatric surgeon goes and fixes this reflux surgically. So we are treating the child medically, and almost the same child is now having grade 1 to grade 2 reflux, may not need surgery at all. This is another 3-year girl child with bilateral reflux and recurrent UTI. Now here, this is another very, very important, as I've already discussed, myelomeningocele or occult spina bifida, where there is no myelomeningocele, just a tuft of hairs at the back. Now these children often have a tethered cord, they often have inability to void, they often have detrusor sphincter dyssynergia, they may even have neuropathic bladder. So all these children, the parents must be counseled from day one that despite surgery, despite a very good resection of the myelomeningocele, the child will have voiding, and remember that all these children are born with normal kidneys. So if this child goes on and goes to renal failure, so it's a failure of the primary physicians who didn't counsel the parents well. So we have incontinence, dribbling, thick-walled bladder, increased post-void residue, and normal or dilated upper tracts in all minor meningoceles. So how do we prognosticate? I mean, what are the subgroups of patients who are good, who are safe bladder, and what is the subgroup who are bad? Like this 9-year-old male has no lower limb weakness, operated for myelomeningocele, but continually dribbles day in and day off. So ultrasound shows normal upper tract. Now this is a safe child. A child who is continually leaking, upper tract deterioration chances are very less. Creatinine is with normal limit. So this is a urodynamics. So we find that the capacity is good. This child is on oxybutynin. Compliance is 20. And this is a safe bladder. Now this, for the leakage, it needs a bladder neck procedure. But chances of damage to the upper tract is extremely less. But this particular child is another myelomeningocele, a similar presentation, but a 2-year female, but the bladder looks pretty bad. There is an entirely trabeculated bladder and there is no void. So this is an MCU, but we cannot see any voiding. So there is a severe discoordination between the sphincter and the detrusor, and thick urinary bladder wall, bilateral hydronephrosis, hydroerythronephrosis. Creatinine is 0.4, but this creatinine will go up and rise. This is the urodynamics. This should have been baseline. This baseline is going up, going up, going up. So these kidneys are at very, very very severely high risk of getting damaged. So this is how you prognosticate that which child will go to renal failure, and you take adequate. So this is a dangerous bladder. Our conclusion is this bladder is very, very high risk. So this is a posterior urethral valve. As you all know, there is an obstruction at this level. But this child came to us at 10 years of, normally we have antenatal diagnosis nowadays, and we operate within 2 to 3 days of life after birth. This child came to us at 10 years with dribbling. So these are the various, these are some patients with flowmetry, and this shows very severe overactivity. So this is, so basically, this is not a clinical forum. So basically the take home message is it's unfair and unethical to treat children with voiding disorders empirically. Whenever there is leakage, a child comes with bedwetting, people give tropan, people give oxybutynin. This should never be done. You should systematically examine the child and judicially utilize this particular investigation of non-invasive and invasive urodynamics. Especially children with posterior urethral valve and myelomeningocele should need long-term follow-up. And this is, I would like to end with a small video. I don't know whether you can you see the video running? Is it visible?
Yes,
so this is, because its technological advancement is being discussed. So this is, we are utilizing thulium fiber laser for fulgurating posterior urethral valve. This we have been doing for last 1 year. So this is the valve leaflets. This is a small child, and you can see the valve leaflets very well. So these are the obstructing membrane. So long we have been using diathermy, and we are using hook for fulguration. Now of late, for the last 8-10 months, we are using thulium fiber laser, and it's a fantastic tool. The damage is the verubonitum, as you all know. We can see the very hypertrophic bladder neck, the entire bladder mucosa is trabeculated. This is one of the ureteric orifice. This is the right ureteric orifice. Then we gradually go to the left ureteric orifice. This one is a left ureteric opening. So this is a laser fiber. It's a very microscopic, I mean, very miniature fiber, 3 micron fiber. Sorry, and 50 micron fiber. So we are using laser beam. This is a thulium fiber laser beam. It's being used to just vaporize the. And the beauty of this laser is the penetration is so less that it will never damage anything up to the wall. It will not damage the wall. So it is just vaporizing the bladder, the obstructing membrane at the urethra. And remember, this is a small child. So whenever we use current, we use a very low current, but there is a potential of the current to cause a stricture. There is a potential of the current to cause collateral damage, lateral damage. But this laser is a very nice thing. And if you can utilize it properly, so we can completely vaporize the posterior urethral valve without any damage to the surrounding wall. And in our short follow-up, we have done around 17 children with TFL laser, and till now the outcome is very good. There is no bleeding at all, and normally after fulguration we keep catheter for 48 to 72 hours. In those babies where we use laser, we can remove the catheter within 24 hours, and the child goes home without catheter next morning. So that's a technological advancement, and maybe within next few years we can use technology more and more to create more and more safe lives and help many more children. So that's the 5 o'clock leaflet being burnt. So laser doesn't burn, laser just vaporizes the tissue. So we have done check cystoscopy in many of these patients, and they are very good, doing very well.
Thank you so much, doctor.
I request you to share a thank you moment on behalf of Golden Aim team.
Thank you, sir. Thank you so much.
Now we move on to our next respected speaker, Dr. Sanjay Shah. He is President of Indian Association of Traumatology and Critical Care. And sir's topic is harnessing technology in healthcare.
Thank you very much for kind introduction and giving me this opportunity to share my views on technology and coming in a big way in the healthcare industry. I have nothing to disclose. Yes, there is a definite increase of usage of technology by patients or consumers as per their requirement in last decade, but more so in after pandemic. The pandemic has changed the overall attitude towards life. And one more aspect which has got changed, that is the way we deal with the day-to-day, and most of the requirement got fulfilled by technology. So the consumers are going more on online to obtain medical information for multiple reasons. More than 45% of the searches are for doctors, 38% for hospital and medical facilities, and more than 77% they book medical appointments online nowadays. One of the other study which has showed use of internet based on various searches, that is like general medical research and news for more than 70% of the time, accessing guidelines or protocols around 50% of the time, and so forth, like submitting claims, diagnostic reporting, accessing pharma, communicating with the patients, data analysis, and order and verifying the prescription. In one of the study which was conducted for the doctors, like more than 80% of the doctors agreed that internet applications are nowadays essential or important aspect of life. And value of technology in healthcare has increased significantly for faster claim payment, improved patient care through early diagnosis, lower administrative cost, reduced prescription error. Healthcare personnel can first give more time to their patients, lower medical supply cost, higher reimbursements, and lean operations. So what is being expected out of a doctor in today's era? That he has to use a technology for better optimum utilization and having integrated approach, a holistic approach to the patient care, along with the digitalized version, whether it is HIS or EMR. Academics and research, particularly in healthcare education, is also coming up a big way as far as technology is concerned. And one has to practice evidence-based medicine. But yes, there is a concern of interoperability, and use of internet by doctor for core business or clinical function is a challenging aspect, because not all doctors are same, and same is for nurse and paramedics also. So there would be some kind of doctor subset who would be resisting for using this high technology and may not be well versed with it. So I covered up till now, like the value of technology in healthcare for faster claim payment, improved patient care, reduced prescription error, more time to give with the patient, and lean operation and all. And what is being expected out of doctor is to utilize integrated approach, better technology utilization, holistic approach to the patient care, use the newer digitalized version, be it HIS or EMR, and utilizing the healthcare education also using this technology, and to practice evidence-based medicine. But there is a concern of interoperability. As I told you, not all the doctors would be very well versed with the technology. And some of the doctors might have a resistance to use these internet applications, and that might be a challenge to overcome. And there are critical issues in forecasting and speed adoption of that technology as well. We all know that healthcare has a significant data, right from hospital to pharma industry to research and development of the drug and discovering various devices. And if we can use this data and analyze this data, that is called as big data analytics from technology, if we can do that, we can actually move from curative to preventive aspect, like choosing the right people in the right order, in the right place, doing the right thing in the right time with the right outcome. That will turn out to be giving the best patient experience. And we might predict certain patients who will not fall ill again or with recurrent issues. And that's how we can have a preventive aspect of it, or rather preventive medicine will come up in a big way, particularly when this artificial intelligence and machine learning is coming. Maybe in down the line, 5 years, it will change the scenario of the way we look at it in healthcare. Yes, this big data analytics can reduce or help us in reducing the rate of medication error by, going through the patient care records. Software can flag any inconsistencies between patient's health or drug prescription or altering healthcare person, alarming them for a potential risk of error. It can help us in facilitating preventive care, like high volume of people they come for the emergency visits, what is being called as frequent flyers, making it around 25 to 28% of that visit in emergency department very recurrently. And by this technology, we can, prevent them for frequent return to the emergency department. Accurate staffing also can be helpful. This analysis can help us when we are expecting higher admission rates or when we have a lowest number of staff, so that we can reduce the emergency room wait times as well. And Cleveland Clinic has already started this. Apollo is also coming up for this kind of emergency room technological advancement, where we can reduce the wait time right from ambulance. We can see that what kind of priority patient it is coming, and we can start mobilizing the resources in that area. Electronic medical records and electronic health records are also important aspect. EMR is an electronic medical record within a single health organization, which is easy to do. And now many of the hospitals have started using this. But what it is in India is lacking is EHR, and that can be seen by authorized clinicians or staff across the organization in the country. And if we can have a centralized area where this can be uploaded, like a National Health Information Network or a Health Information Exchange kind of setup, where all the records would be available and it can be accessed by with the permission to the healthcare personnel, so that they can locate from the area of the practice. And even the migrating patients can be, easy to treat at a different setup where he might not have got undergone investigation. So that's the beauty of EHR. And then many of the further recurrent visits in the emergency also can be prevented. The advantages of EHR is like earlier detection of infectious disease outbreaks, like COVID right now, what we had in last 1.5 years. If some kind of infectious disease is outbreaking, as an individual healthcare personnel or one of the hospital might not be able to depict as outbreak, but if it is happening across the city in various numbers, then this EHR can alarm in that geographical area, and that prevention steps can be taken very early. Improved care for chronic diseases, improved ability to evaluate healthcare through national collection of identified price or quality information. Productivity and financial efficiency also can be improved. Even the reimbursement process can be faster, and you can get a better claim because your records are complete well within time and all the documentation is being provided. Quality monitoring for payers and care coordination to the patient. Coming up a big way, another thing is treating the patient with a virtual reality, like wearable medical devices, like heart rate sensors, exercise trackers, sweat meters, which can monitor blood sugars. And we all know that oximeters also now come up as iPhone watch, where for respiratory patients, it will be very helpful to monitor pulse and SpO2 and all that. The wearable technology can help healthcare companies save money. Like one of the studies which has shown that this can save US healthcare system close to $7 billion per year, which is quite huge. What it can help us, it personalizes the healthcare experience, like medical devices give patients a sense of ownership when they are having that I am being monitored by someone else, like whether it is nurse or doctor, in the process of improving their health. Another big important thing is targeting insurance pricing. It is also coming up probably in a couple of years. It would be there in India that information obtained from wearable devices can help insurers more accurately to predict the patient's risk of illness, and that's how they can price the premium. And there would be incentive for those patients who take preventive measures to improve their health, which can reduce the premium because they are now fit and their profile is of less risk. It does provides gamification opportunities like some medical devices like wearable watches and XYZ can create competitive goals for users to achieve through exercise, diet, nutrition. They can be tailor-made as per the individual's requirement, and there will be goal set, and accordingly incentives can be given. So, and same sensors, not only just for the people or population at large, but even in the hospital, particularly in setups like ICU, OT, cath lab, and emergency department, which are quite sensitive. Like these smart sensors for monitoring will affect the control of diabetes, patients with congestive heart failure or chronic kidney failure, respiratory ailments, sleep disorders. They can be monitored from remote areas by a doctor or from one of the hospital and other remote centers as well, so that patients will be safer and the alarms can be set and they can be treated very early before they start deteriorating. The trend can be picked up quite early than actual deterioration. The biometric monitoring also, like indicators with labor or non-invasive devices in the ICU bed with the sensors and monitoring, that can also help us in detecting trend of deterioration or improvisation. Point of care testing is being available almost in most of the hospitals, but what we are not able to do right now is analysis, because this EMR and EHR is not getting converted and getting digitalized. If it does, then these analytics can help us taking significantly ahead of predicting some of the patients who would be on the verge of deterioration or on the prognostic markers can, for cancer patients also, preventive as well as prognostic markers can make the change in the outcome. Pre-hospital care, particularly as I told you earlier, Apollo has just started collaborating with Airtel 5G and Cisco, that the ambulance would be CCTV inside surveillance, as well as these gadgets would be seamlessly in connectivity with the ER department and ER physician, where patient can be monitored not only physically but along with the ECG monitoring or multipara monitoring and whatever the test like sugar and ECG is coming. Artificial intelligence and machine learning is coming up significantly. It is not just a digital transformation trend in healthcare, but it representing the epitome of medical innovation and industry players. It is going to be a big market, more than $35 billion by 2025, and it is going to change the healthcare industry significantly. There are various applications of artificial intelligence and machine learning. Particularly, it has started up with the radiology and telemedicine, like Rapid AI, which is detecting stroke in CT or MRI brain with accuracy of more than 98%. Telemedicine, there are multiple providers of telemedicine across India. Even Government of India is also pushing it and doing significantly in certain states. Oncology, drug discovery and design of it, nursing robots, which are for delivering medicines at the patient's bedside. Genomic analysis is also coming up big way with the help of AI. Emergency department monitoring the pre-hospital care along with prioritizing patient in the ED, robot-assisted surgeries, home health and wearables. And one more area which should not be, ignored is preventive medicine, particularly cancer screening and detection, diagnostics. These are the areas where AI is going to change the way we look at it right now. But yes, of course, there are certain set problems, like problems with out of the box where AI might not be able to have a solutions readily available, and it might have a fallacy, either false negative or false positive. So it has to be supervised by a doctor. As of now, it is not going to substitute a doctor. And there would be a difficulty when algorithmic bias and user biases are there. It is like when the device or that AI solution is being made and fed and trained with a lot of data, but that data feeding was having significant bias like male versus female or Caucasian versus Asians or white versus blacks, then certain set of the problems might not be very peculiar in that data. And if the solution is using a different set of patient, then it might have a fallacy or may not be able to detect it properly. There is significant concern of data security and privacy issues because most of this data is going to get transmitted over open airwaves, vulnerable to intercept, easily getting stolen or shared on public infrastructure. And that's how patient privacy is going to get leaked. So one has to have a solution of this. Compliance and regulatory issues are also a significant challenge because if it is wrong, what is going to be a medical legal implication of it? How are we going to solve that? Then that has to be answered. There are startup issues as well as the investment problem. But what it causes going to alarm is on skill atrophy because the manpower would be not having much of the skills when AI is working more than the individuals. So it has barriers to broad scale adoption like lack of compatibility between the systems, lack of resources to convert existing paper records into the EMR or EHR, inability to find real world systems, lack of capital for investment because obviously this is not going to be a cheaper version of substituting or complementing the human skills. Physicians' reluctance to change is also a significant challenge, and it needs significant time and behavioral changes to adapt, and concerns about confidentiality on internet. Then there will be a challenge on infrastructure aspect also. There are strategies like closed proprietary network or public internet strategy, which requires greater bandwidth, faster transmission with the next generation internet infrastructure, which is going to take time. But rather than that infrastructure, which can be built upon maybe in a couple of years or 3 years, but the other challenges like medical legal issues, data biases, and data privacy is going to be a significant challenge. We know there are certain mobile apps, maybe by government or private organizations like Arogya Setu, CureFit, Pharmacy, XYZ. There are many more and which are multiple coming also into the market. There would be immunization tracker like COVID. India fights dengue, one of the government side. And then there are other Pradhan Mantri Surakshit Matritva Abhiyan and so forth, which has already taken a shape as digitalizing Indian healthcare scenario. And there are many more coming in. This is a small list of government initiative as far as digital health is concerned, like COVID dashboard, health and wellness centers, Lakshya, national program for healthcare for elderly, mental health website and dashboard, emergency medical response website and dashboard, international health and Pradhan Mantri Swasthya Suraksha Yojana. So to summarize, yes, in healthcare industry, technology is going to shape up significantly in next 5 years or so. Artificial intelligence and machine learning is the key factor driving technology in healthcare. And this is going to impact almost every area of the healthcare industry. More so, some of the examples have already been discussed. EMR and EHR is necessary to have, and also fast data conversion is going to be a big challenge. What we are going to do with the paper records which are existing in nature. Solutions required for data safety, infrastructure development, and regulatory challenges. Radiology, telemedicine, and preventive medicine has a huge scope, and it is going to get changed over next couple of years or so. And rest of the areas will take its own due course of time because of longer learning curve as well as cost and resources availability. Thank you very much for the patient listening, and I'm happy to take the questions if any.
Thank you so much, doctor.
Thank you.
And I request you to present a thank you moment on behalf of Golden Aim team.
Now we move on to a much awaited award ceremony. And our first category for the award is Quality Healthcare Services Hospital and Research Center. And the award goes to Dr. D.Y. Patil Medical College, Hospital and Research Center, Pune. Congratulations.
Thank you, sir. Thank you for your kind consideration and for giving us the opportunity. Myself with Dr. Itik Chauhan, who is our medical superintendent, Dr. Jaydeep, who is our medical director, Dr. Darshane, who is our additional MS, and Dr. Sana, who is our consultant. All of us are here along with our CEO, Dr. Date. And on behalf of the institution, it's our pleasure to accept the honors. Thank you very much, sir.
Thank you so much, Doctor.
Thank you so much, sir.
Our next award category is Iconic Healthcare Leader Award, Nephrologist. And the award goes to Dr. Chaudhary Sudhir Das, Senior Consultant and Head of Department of Nephrology, Jaslok Hospital and Research Center, Mumbai. Congratulations, Doctor.
Thank you. Thank you so much. I must thank the organization of the Golden Aim Awards and the selection committee for choosing me to get the honor of this iconic award for the field of nephrology. And this is a recognition which is much more dear to me and will boost my confidence level in taking part in the patient care itself. And I have since the login, I have looking into the very good slides and the opportunity to see the organizers' commitment of improving the healthcare by digitalization. And also, since I am also a advanced certified certification of digital health by the Indian Institute of Science. So I saw those slides and other things and rejoiced. Thank you so much. Thank you so much.
Thank you so much, Doctor. Our next award is Dr. Geeta Bharia Sheikh, Professor and Head, Department of Nephrology, Grant Government Medical College, and Sir J.J. Group of Hospitals, Mumbai. Congratulations, ma'am. Our next awardee is Dr. Dilip Rangarajan, Senior Consultant Nephrologist and Group Medical Director, NU Hospitals. Congratulations, Doctor.
I thank the Golden Aims Awards Committee for having conferred on me the Iconic Healthcare Leader Award Nephrologist for recognizing our tertiary nephrology care as well as our preventive nephrology care, which is done in a very ethical and protocolized manner. Thank you very much for the award. It's my pleasure and my privilege to accept this.
Thank you so much, Doctor. Our next awardee is Dr. Siddharth Lakhani, Consultant Nephrologist and Transplant Physician, Fairkey Fortis, Raheja Global, Criticare Asia, and Jaslok Hospitals, Director at Lakhani Kidney Care. Congratulations, Doctor. Our next awardee is Dr. Vidhanshu Gupta, Senior Consultant and Head of Nephrology Department, Pushpanjali Hospital and Research Center, Agra. Congratulations, Doctor.
It has been indeed a pleasure and privilege to get this award from the Golden Aims. And I wholeheartedly thank the whole jury and the guiding people for giving me this award. It has indeed been a privilege. I thank you once again with wholeheartedness. Thank you.
Thank you so much, Doctor. Our next awardee is Dr. Praveen Kumar Itta, Consultant Nephrologist and Kidney Transplant Physician, Virinchi Hospitals and Max Super Specialty Medical Center.
Praveen Kumar Itta.
Congratulations, Doctor.
Yes, thank you. Thank you very much. Thank you for selecting me. It's a great privilege and honor to receive this Golden Aim Award for this year in 2022. I'm extremely thankful for the selection committee for the recognition I have received for my work in nephrology field. Thank you very much.
Thank you so much, Doctor. Our next awardee is Dr. Mahendra Kumar Atlani, Assistant Professor of Nephrology, All India Institute of Medical Sciences, Bhopal. Congratulations, Doctor. Our next awardee is Dr. P. Hari Prasad, Consultant Nephrologist, Prasad Kidney Clinic. Congratulations, Doctor. Our next awardee is Dr. T. Saravanan, Nephrologist and Transplant Physician, Abhirami Kidney Care, Dr. Thangavelu Hospital, Erode. Congratulations, Doctor. Can we have few words from you, sir?
Thank you, Golden Name Awards and the team. Our family has been into medical profession since 1985, over 3 decades. I started my journey as a nephrologist in 2013, and I returned to my native place, Erode. And then we started a super specialty hospital. I am playing a dual role as consultant nephrologist and managing director in my organization. At present, we are performing close to 3,000 dialysis sessions, most of which at free of cost under CM scheme. And we have main center at Erode and 3 satellite centers. One is at Karur, Gobichittipalayam, and Avinasi. My main motto is to create public awareness among detection of kidney diseases. My vision for the future is to establish multiple satellite centers across Tamil Nadu to make the life-saving dialysis reach more downtrodden population. And I am the present Erode IMA branch secretary. In this era of atrocities against medical professionals, these recognitions will heal the wound in medical heart and increase their passion towards medical profession. This award is considered as a recognition to those sleepless nights and selfless work in patient care and even during the COVID pandemic. And I am delighted to share that on the same day, we received another award for Best Kidney Hospital. And I thank my patients whose belief on me is considered to be the major reason for this award. I immensely thank my parents and family and my tirelessly working nursing staffs for this award. Last but not the least, I wholeheartedly thank Golden Name Awards team for recognizing my work in the field of medicine and allocating me this award. Thank you once more, Dr. Saravanan.
Thank you so much, sir.
Our next awardee is Dr. V. Ramkumar, Senior Consultant Nephrologist and Transplant Physician, Crane Clinic, Salem. Congratulations, Doctor.
Thank you, Golden Aim Awards Selection Committee, for recognizing our work. This will motivate us to do more and more for our patients. And thank you once again. Thank you.
Thank you so much, Doctor. Our next awardee is Dr. Saurik Dalal, Consultant Nephrologist at Dalal Clinic. Congratulations, Doctor. Next awardee is Dr. V. Subbarao, Nephrologist, Apollo Hospitals, Chennai.
Thank you very much for awarding this award for being a nephrologist in India. But the whole credit for this award should go to my whole team in Apollo Hospitals, Chennai. And this award will be the honor to our unit, who have been doing a meritorious job for the last 35 years. We have done the maximum number of transplants, maximum number of dialysis in the country, and we have been one of the oldest center in the country. And then this credit should go to our unit. I wholeheartedly thanks the award committee to award this award to me on behalf of my hospital and my unit. Thank you very much.
Thank you so much, Doctor. Our next awardee is Dr. Amanda Nalamati, Consultant Nephrologist, Arun Kidney Center, Vijayawada. Congratulations, Doctor. Our next awardee is Dr. Naveen Kumar Banwal, Consultant Nephrologist, Orchid Hospital, Ranchi. Congratulations, Doctor. Our next awardee for this category is Dr. P.S. Wali, Nephrologist and Transplant Physician, Asian Institute of Nephrology and Urology, Dilsukh Nagar. Congratulations, Doctor. Our next award category is Quality Healthcare Educational Institute Award. And the award goes to Dr. D.Y. Patil Medical College Hospital and Research Center, Pune. Congratulations to Dr. D.Y. Patil.
Thank you, sir. And it's indeed a pleasure to receive this award because for last 25 years, Dr. D.Y. Patil Medical College Hospital is standing not only for the services of the local area region, but nationally also. And the hospital and the infrastructure, with the blessings from our Chancellor, Dr. P.D. Patil, and Pro-Chancellor, Mrs. Bhagyashrita Patil, ma'am, as well as our trustee and young dynamic treasurer, Dr. Yashraj Patil, who is himself the radiologist. It's indeed a great pleasure to get the recognition from Golden Aim Award, and we're very we're very happy to receive this award, and a promise to keep that we will excel in the field of healthcare education further. Your blessings are required. Thank you very much, sir.
Thank you so much, Doctor. Our next award category is Best Healthcare Infrastructure in Pune. And the award goes to Dr. D.Y. Patil Medical College, Hospital and Research Center, Pune. Congratulations.
Thank you, sir. The infrastructure indeed is worth international standards. And even the team from Johns Hopkins has given the remark that in case such wonderful facilities are available in Johns Hopkins, including the robotic surgeries and all state-of-the-art infrastructure, including the operation theaters from Mackay and Drager and the modular operation theaters, we have created wonders. We'll have to wait for 20 years what the specialist from Johns Hopkins is to give. So this is really the prestigious moment for the institution, and I humbly accept this award on behalf of the institution. Thank you very much, sir.
Thank you so much, Doctor. Our next award category is Iconic Healthcare Leader Award, Nephrologist and Transplant Physician. And the award goes to Dr. Chandan Chaudhary, Nephrologist, Wokhart Hospital, Mumbai. Congratulations, Doctor. Our next awardee is Dr. Siddharth Mawani, Consultant Nephrologist and Kidney Transplant Physician, Mawani Kidney Care, Ahmedabad. Our next award category is Iconic Healthcare Leader Award, Nephrologist and Renal Specialist. And the award goes to Dr. Anil Kumar BT, Nephrologist and Transplant Physician, BGS Gleneagles Global Hospitals, Bangalore. Congratulations, Doctor. Our next award category is Women Healthcare Leader Award, Nephrologist. And the award goes to Dr. Professor Manisha Sahay, Professor and Head, Nephrology, Osmania Medical College and Hospital, Hyderabad, Telangana. Congratulations, ma'am. Can we have a few words from you, ma'am?
Yeah, sure. At the outset, I would like to thank Dynergic Business Solutions for honoring me with this award, and I would like to convey my thanks to the jury for selecting me for this award. This award holds a special place in my life, and April has been a fantastic month for me. I received recognition from Telangana state government and also from Dynergic Solutions. I've started my nephro career in 2003, and subsequently I've been working as professor and head of department of nephrology at Osmania Medical College, Hyderabad, which is a government medical college. I have a great passion for teaching, and I'm so proud that I'm able to help the poor patients by doing transplants, by dialysis, completely free of cost. The complete care at our center is free of cost for the patient. So I feel proud to work for my patients in my country, in India. And during my tenure, I have held several leadership positions. I thank the Indian Society of Nephrology for being very supportive to the women in nephrology as well as the Indian Society of Organ Transplant. I've held the position of Vice President of Indian Society of Nephrology as well as the Executive Member of Indian Society of Organ Transplant. And I'm currently Editor-in-Chief of Indian Journal of Transplant. So I am very proud. I'm honored to receive this award. I thank my patients. I thank my parents who have always been very supportive, and my husband who is also in the same profession. So again, I thank the Dynagic Business Solutions, because awards are one way to encourage further good work. And I promise I'll keep on working for my patients and for betterment of kidney healthcare in India. Thank you again for this opportunity. Thank you.
Thank you so much, ma'am.
Thank you so much, ma'am.
Our next awardee is Dr. Neha Singh, consultant nephrologist, Metro by Park Hospital, Palam Vihar, Gurugram. Congratulations, ma'am. Can we have a few words from you, ma'am?
Good afternoon, everyone. I would like to thank the organizers, my colleagues, and respected seniors for considering me worthy of this award. I shall continue my endeavor in the field of nephrology to provide better healthcare. Awards are a good way to motivate us doctors to keep doing our best. So I would like to thank the Golden Aim Awards team. Thanks a lot.
Thank you so much, ma'am. Our next awardee is Dr. P.N. Jikki, Principal, Kurnool Medical College, Andhra Pradesh. Congratulations, ma'am. Our next award category is Women Healthcare Leader Award, Diabetology. And the award goes to Dr. Parjeet Kaur, Senior Consultant, Medanta, the Medicity. Congratulations, ma'am. Our next award category is Women Healthcare Leader Award, Oncology. And the award goes to Dr. Renuka Gupta, Gynae Oncologist, Action Cancer Hospital. Our next award category is Iconic Healthcare Leader Award, Diabetology. And the award goes to Dr. Meenakshi Sundaram Lakshmanan, Physician and Diabetologist, LM Medical Center. Congratulations, doctor. Can we have a few words from you, sir?
Yeah, good evening, everybody. At the outset, I'd like to thank the organizers of Golden Aim Awards and the selection committee for choosing us for the Iconic Healthcare Leader Award in the field of diabetology. Our main focus is reversal of diabetes and its complications, particularly micro and macrovascular complications. We have shown reversal of diabetic nephropathy and heart failure in hundreds of patients in the past decade using the newer agents, particularly ARNI, SGLT2 inhibitors, MRAs, and beta blockers. We have screened over 50,000 diabetic patients in the past decade before the onset of the COVID. We thank you for the recognition. Thank you.
Thank you so much, doctor. Our next award category is Quality Healthcare Leader Award, Oncology. And the award goes to Dr. Sampatha Desai, Senior Consultant, Gynecologist and Oncologist, PD Hinduja Hospital and MRC, Mahi. Congratulations, doctor. Can we have a few words from you, ma'am?
I thank the organizers for recognizing me for my contributions in the field of gynae oncology. This award does not belong to me, it belongs to my patients. I have been lucky to help this lot of these patients to fight the gynae cancers, and which most of them have eventually won. I need to acknowledge my colleagues, teachers, and my family who has supported me throughout this journey of treating cancer patients. Thank you once more.
Thank you so much, ma'am. Our next award category is Quality Healthcare Leader Award in Critical Care. And the award goes to Dr. Rahul Pandit, Director of Critical Care, Otis Hospital, Mulund, Mumbai. Congratulations, doctor. Our next awardee is Dr. Mehul Solanki, BAPS Yogiji Maharaj Hospital, Shahibag, Ahmedabad. Congratulations, doctor. Can we have a few words from you, sir?
Thank you to honored me. Thanks to the Golden Aim Awards and Dynamic Business Solutions and all juries. I am heartily thanks Almighty Gods, my gurus, my parents, my families, especially to the hospital staff. Without them, it won't be possible. I am Dr. Mehul Solanki, working as a critical care specialist in BAPS Yogi Ji Maharaj Hospital, Shahibag, Ahmedabad. First of all, I indeed felt my gratitude to the Golden Award and jury and supportive partner by the Dynamic Business Solutions. Thanking you, jury, have identified me in Quality Health Leader Award. Healthcare means a disease, suffering, and emotional liabilities. Rather than the treatment care, I also focused more on a tender, loving, and the quality care to my patients. I thanking all of my teachers, my well-wishers, and my mentors. Thank you all.
Thank you so much, Doctor. Our next awardee is Dr. Pragyan Kumar Rautre, Head of Department Critical Care, Care Hospitals, Bhubaneswar. Congratulations, Doctor. Our next award category is Quality Healthcare Leader Award, Aesthetic Medicine. And the award goes to Dr. Raghuvir Mathur, Aesthetician and Cosmetic Dermatologist, Perfect Point Weight Management Laser Skin and Hair Transplant Clinic. Congratulations, Doctor.
Good afternoon, my fellow awardees and members of the jury panel. I, Dr. Raghuvir Mathur, would like to thank Golden Aim Awards for conferring me with this award and for the recognition they have given me for the work in aesthetic medicine. For the past 22 years, my wife, Dr. Shipra Mathur, who is a weight management consultant, and I have been running Perfect Point, which is an obesity management, laser, skin and hair transplant center in Kanpur. Over the years, our aim has been to provide the best service possible to our clients. You know, in the field of medicine, it can get difficult to keep up with technology and its advancements. But here at our center, we keep launching new therapies, new equipments, the latest and best technology from time to time, and offer the same quality services like in other bigger metropolitan cities like Delhi and Mumbai, but at a lesser, more affordable price point. We take immense pride in the work that we do, whether it is shaping people's lifestyles for the better or restoring someone's confidence through a hair transplant or a weight loss treatment. I thank you once again for your recognition of my work. I thank my parents, wife and children for their immense support. Thanks the jury again, once again. Thank you.
Thank you so much, Doctor. Our next award category is Quality Healthcare Leader Award, Endocrinology. And the award goes to Dr. Arpandev Bhattacharya, Consultant Endocrinologist, Shiva Jyoti. Congratulations, Doctor. Our next award category is Iconic Healthcare Leadership Award. And the award goes to Dr. Abhay Chheda, Director for Center for Cosmic Homeopathy. Congratulations, Doctor. Can we have a few words from you, sir?
Thanks a lot to Golden Aim Awards and the jury and the co-awardees. Thank you for selecting me for the work done. It was a simple act of service to society, and that resulted into this award. Also, thanks for a wonderful seminar of today on nephrology. Thanks a lot.
Thank you so much, Doctor. Our next awardee is Dr. Santosh Nimbalkar, Consultant Development and Behavioral Pediatrician, Moria Multi-Speciality Hospital, Maharashtra, Kolhapur. Congratulations, Doctor.
Thank
Can
you.
we have a few words from you, sir?
Yeah, thank you, sir. I thank the Golden Aim Awards for conferring with me with this iconic healthcare leadership award. As a pediatrician, I've been working in this field for almost 24 years, but my subject expertise has been developmental neurology, and for the past 16 to 17 years, starting with the Universal Newborn Hearing Screening Program and the retinopathy of prematurity program way back in 2006 was a great task for me. It was a great challenge especially in our place like three-tier city like Kolhapur in Western Maharashtra. I was the first one to start these two programs in the Western Maharashtra, apart from Pune, this has resulted me into starting the first child development center in the Western Maharashtra in our hospital in 2012. We work in areas of dyslexia, autism, intellectual disability, hearing impairment, and we have a lot of specialists who are there, like the psychologists, the clinical psychologists, occupational therapists, physiotherapists, the special educators, whom I think so I should credit the award for. They are also a part of this this award, and I also thank my parents, my friends, colleagues who have been very supportive. In fact, we are in the near future, we are planning to start the cochlear implant program in our own hospital, and probably it will be one of the first implant surgeries in the Western Maharashtra. I thank also some of the frontline workers in this field, like the Asha Sevikas and Anganwadi Sevikas, whom have been training about these specialties of these specialties, and they have been about this particular specialty. And apart from being a development pediatrician, my work in the social and the community as a community pediatrician has been, in fact, I've been blessed by the society for giving me the opportunity to work in this area. In fact, we have started the first human milk bank in Kolhapur, rather I would say in the Western Maharashtra, apart from Pune. This is a government setup, and I have been instrumental in setting up this human milk bank which is attached to a government medical college. Probably this is going to save a lot of infants, newborn babies, and also not only decrease the mortality, but also decrease a lot of morbidity in these patients. So I feel blessed by that the Almighty has given me the energy, the enthusiasm to continue my passion as a service provider. I once again thank the Golden M Awards jury members for conferring me, for selecting me for the Iconic Healthcare Leadership Award. Thank you very much.
Thank you so much, Doctor. Our next awardee is Dr. Rajendra Singh Arora, Director, Sudan Surgical Cancer Hospital and Amravati Cancer Foundation, Amravati. Congratulations, Doctor. Our next award category is Best Professor Award in Kaya Chikitsa Medicine, Specialty in India. And the award goes to Dr. Sachin Kumar Sahebrao Patil, Professor and HOD, Department of Kaya Chikitsa Medicine, Maharashtra Ayogya Mandals, Sunantibai Shah Ayurved Mahavidyalay, Malgudi Hadapsur, Pune. Congratulations, Doctor.
Good evening to everyone. It is my honor to receive this award, Best Professor Award, Kaya Chikitsa Medicine Specialty in India. It is a great motivation and great appreciation for me. I also thanking to my parents to support me. I also thank you for giving this award, for organizing committee members and Golden Name Awards and Conference organizer, who is organized by mainly Dienergic Business Solutions. So I am very happy receiving this award. Thank you very much.
Thank you so much, Doctor. Our next award category is Iconic Healthcare Leadership Award, Dermatology. And the award goes to Professor Dr. Shekhar Nana Pradhan, Professor and Head Department of Dermatology, Vijay Government Medical College, Pune. Congratulations, Doctor. Our next award category is Women Healthcare Leadership Award. And the award goes to Dr. Ashwini Jogade Pandhare, pediatrician, hospital administrator, medical superintendent of Nanavati Max Super Speciality Hospital, member of ICC National Healthcare Committee member, Maharashtra. Congratulations, ma'am.
Thank the jury for considering me this for my award, and I dedicate this award to my family, especially to my children who have always been very supportive. Would love to have a lot of interactive sessions in the near future. Since there's a lot of noise, I would like to just thank and end my short note, vote of thanks. Thank you.
Thank you so much, ma'am. In my life, I have always learned to end the event with a positive thought. No matter how hard it was, tomorrow is a fresh opportunity to make it better. At the end, every step must affect forever. Maybe I had to inspire some posters next year. With this now, we come to an end of this award ceremony and today's webinar. Thank you all for participation
Thank you.
for today's webinar.
Thank you all.
Hope you all
Thank
will
you.
back soon.
Thank you.
Now we move on to our much awaited award ceremony. And our first award category is Iconic Healthcare Leader Award, Pediatric Neurologist.
And the award goes to Dr. Vikunt Raju, Professor of Pediatric Neurology, Indira Gandhi Institute of Child Health. Congratulations, sir.
So thanks for giving the opportunity to speak about this award. So at the outset, thanks organization for recognizing and giving the opportunity. Thank you.
Thank you so much, Doctor. Our next award category is Iconic Healthcare Leader Award, Consultant Neurosurgeon. And the award goes to Dr. B.D. Bharat Singh Naik, Associate Professor, KGH, Visakhapatnam. Congratulations, sir.
First of all, I would like to thank the organizers of this event and conference. And thank you very much for selecting me as for the award winner of this occasion. I'm working as assistant professor in Andhra Pradesh, Visakhapatnam, in Andhra Medical College for the last 15 years. So I am specialist in endoscopic neurosurgeries and spine surgeries, and I am in government sector, and we are serving a lot to the poor people, and at the same time we're working in outside also. And this is the good thing that your appreciation awards are giving to the all over the India and overseas. And thank you very much for selecting me as a awardee. Thank you, organizers.
Thank you so much, Doctor. Many congratulations for the award.
Our next award category is
Women
Healthcare Leader Award,
Pediatrics
and Teen Specialist.
And the award goes to Dr. Swati Bhave, Executive Director, Association of Adolescent and Child Care in India. Congratulations, ma'am. Can we have a few words from you, ma'am?
Yeah, thank you so much. On behalf of my organization, AKI, Association of Adolescent in Childcare in India, we are very honored that you recognize the work which we all are doing for pediatrics and teens in the community. Thank you so much.
Thank you so much, Doctor. Many congratulations for the award.
Our next award category is Women Healthcare Leader Award, Pediatric. And the award goes to Dr. Shailaja Malik, Professor, Department of Pediatrics, Dr. D.Y. Patil Medical College, Hospital and Research Center, and founder and director, Yashoda Advanced Human Milk Bank. Congratulations, ma'am. Can we have few words from you, ma'am?
Good afternoon, everybody. Thanks a lot. I'm grateful to the organizers of Asia GCC Awards for considering my name. My journey, this award I dedicate to the mothers who are kind enough and generous to donate their liquid gold as a nectar for needy newborns and needy angels in the NICU. Thanks a lot.
Thank you so much, Doctor. Many congratulations for the award.
Our next awardee is Dr. Anju Agarwal, Director, Professor of Pediatrics, University College of Medical Sciences, and Guru Tegh Bahadur Hospital, New Delhi. Congratulations, ma'am.
Thank you for the award. It is my proud privilege to receive this award on behalf of Asia GCC and Quality Education Council. I've been working as a Director Professor of Pediatrics for last 20 years at University College of Medical Sciences after completing my MBBS and MD Pediatrics from Delhi University. And I've been working for the children, carrying out research and basically training medical students, both MD and MBBS. And this award gives the inspiration to further continue learning, connecting, and inspiring, which is the logo of this award. So thank you for selecting me with the august colleagues in the department. Thank you.
Thank you so much, ma'am. Many congratulations for the award.
Our next
awardee is Dr. Sujata Kanhere, Professor and HOD, Pediatrics and Neonatology, KJ Somaiya Medical College,
Mumbai. Congratulations, ma'am.
Good evening to all dignitaries present today.
At the outset, I wish to thank Dr. Fareen Khan, Chairperson Asia GCC Conference and Awards and CFO Golden Aim Awards, and Mr. Azhar Faruqi, MD, Pharma, and CEO and co-founder, Dynergy. So I just began with saying thank you to Dr. Fareen Khan and Mr. Azhar Faruqi and the jury for awarding me. So I wish to thank Dr. Fareen Khan and Mr. Azhar Faruqi and the jury for awarding me the Women Healthcare Leader Award for Pediatrics as a part of the Asia GCC Awards for Excellence and Leadership in Healthcare in Jan 2022. I'm deeply honored and humbled for this recognition of my contribution to the field of pediatrics for more than 35 years. I'm professor and head of the Department of Pediatrics and Neonatology and head of Pediatric Neurology and Neurodevelopment at KG Somaiya Medical College Hospital and Research Center, Mumbai. As we know, children are the future of the world, and hence, health of children is of prime importance. I'm happy to share that as a medical teacher and a doctor, I had the opportunity to contribute to various aspects of child health, or pediatrics as we call it, including neonatology, pediatric neurology, neurodevelopment, disabilities, pediatric advanced life support, essential newborn care, and infant and young child feeding, and many more. Being a FAMO fellow, FAMO stands for Foundation for Advancement of International Medical Education and Research USA. And as an academician, I have contributed to medical education at the national and international level. I have taken up leadership role in innovation in medicine and also in research, having done my PhD in pediatric neurology, epilepsy, and neurodevelopmental disabilities. I've also worked and contributed to community outreach programs, including health camps in rural and tribal areas. And as a member of many associations, as president, secretary, and EB member of associations like NNF Maharashtra, Association of Child Neurology India, and Indian Academy of Pediatrics, Mumbai, I have worked to raise public awareness for various pediatric issues. So this is a little bit about myself. Once again, I'd like to thank you for this prestigious award in recognition of my leadership role in pediatrics. This will definitely inspire and motivate me to contribute more to society. Thank you so much.
Thank you so much, Doctor, and many congratulations for the award.
Thank you so much, ma'am.
Our next awardee is Dr. Sara Subodh Dhanavade, Professor and HOD, Bharati Vidyapeeth Medical College and Hospital, Sangli. Congratulations, ma'am.
I am grateful to Asia GCC for considering me for this award. I am honored and privileged. I've been in the pediatric teaching, working in a medical college for the last 35 years. And I dedicate this award for all the little children whom we serve and feel really motivated by this award, which will encourage me to give my best services in future. I thank all the organizers once again. Thank you.
Thank you so much, ma'am. Many congratulations for the award.
Our next awardee is Professor Dr. Pramod Jog, Professor of Pediatrics, DY Patil Medical College, Pune, and he was the president of Indian Academy of Pediatrics 2016. Congratulations, doctor.
Thank you. Actually, I wonder whether all the women in the audience, they have their names starting from S. We have Shefali, Dr. Swati, Dr. Shailaja, Dr. Sara, and all my good friends around. It's very nice to have this particular function as a small family function. In fact, we are all pediatricians, and every child likes certain things in life. For example, you know, a child will like to have a variety in the menu. A child will like to have what you say, a pat on the back, okay, and also a definite schedule for life. And as pediatricians, we also understand that encouragement, that is the pat on the back, goes a long way for a person to work further and further. So it's always better to give a pat on the back, and for that I congratulate the organizers to have this particular function. Remember, whenever a person gets success, that's the testimony of collective capabilities. When I work for children and for the society and for an organization, there are so many people with me from whom I derive ideas, inspiration. I look to my senior colleagues who are working in a particular way. And whenever those efforts are appreciated by others, it gives me, what you may say, it injects a momentum into my life. Okay. And I always believe that whenever there is someone who is judging other person, what are the criteria which should be used? One of them, of course, is some innovation in the field of his chosen area. For example, Swati is working in the field of adolescence. Dr. Shaileja is working in the field of human milk bank, and so on and so forth. Okay, then it should have some impact on the society. That means the work has to be useful, particularly for an average Indian child. And the work also should be scalable in future. That means the similar efforts should be appreciated by others, and it should be replicable in other parts of the country. This is my view of looking at any award. I remember the sentence by Einstein, who said that you have to learn from yesterday, you have to live for today, and you have to hope for the future. But the important thing is that you should not stop questioning. Okay, so if one remains a student all throughout his life, then usually success follows that person. So I thank the organizers once more, and I also express my gratitude for this particular award. Thank you.
Thank you so much, Doctor. And many congratulations for the award.
Thank you.
Our next award category is Iconic Healthcare Leader Award, Pediatric. And the award goes to Dr. Hiren Doshi, Director, Nanavati Max Super Speciality Hospital, Mumbai, and Chief Pediatrician, Roots and Wings Children Clinic, Vilepalli. Congratulations, Doctor. Can we have few words from you, sir?
Yeah, good evening, everyone. I first would like to thank the organizers, the GCC, and the Golden Name Awards and the jury members to select me for this prestigious award. Incidentally, I complete 25 years in my organization at Nanavati Max Hospital. So this is quite an opportune time for me to receive this award at this time. I would like to dedicate this award to my team of people, of all the doctors, the nurses who work in my PICU and ICU at my organization, and to the management of Nanavati Max Hospital, who has always been quite supportive and helped us in getting the pediatric department better and better. And so thank you everyone for the award.
Thank you so much, Doctor. And many congratulations for the award.
Our next awardee is Dr. Nitesh Kumar Agarwal, Director and Pediatric, Southern Gem Hospital. Congratulations, sir.
Good evening, everybody. Good evening, everybody. I'm Dr. Nitesh Agarwal, primarily a neonatologist. I actually trained overseas, and I came back from Australia 2011-12 to kind of work in our own setup in India, in Hyderabad. So I came and joined a corporate hospital, and the thing was good. We were giving good treatment and other things, but then I thought the cost was high. So we started our own unit, a neonatal unit, and from there we started growing. And today we are actually having a proper full-fledged hospital where we are treating not just newborns, but also general pediatrics and some PICU work as well. When it comes to teaching, I've been involved in both formal and informal teaching for the last 21 years. So firstly, while that is going on, I would like to thank the organizers for giving me an opportunity to be able to present today in this gathering, where I can see a lot of my own teachers around as well. So obviously, if I have been around for 20 years, there's a lot of people in this particular room who've been there for way longer than us and have been instrumental in our growth. So thank you to the organizers, and thank you to all the teachers and colleagues in this group for giving me this award. Thank you so much.
Thank you so much, Doctor, and many congratulations for the award.
Our next awardee is Dr. Ashok Rai, Director, Indian Institute of Cerebral Palsy and Handicapped Children, Varanasi. Congratulations, Doctor.
I'm very much thankful to Asia GCC for giving me this award and prestigious award. And award always encourages us to do some further good work. And I'm seeing my good friend, Professor Pramod Jog is here, and my teacher, Dr. Swati Bave, and friend Dr. Nitesh Agrawal, and so many persons are there. I am deeply honored and humbled to receive this award. So once again, thankful to Asia GCC, especially Dr. Farheen Khan and Dr. Fahad. Thank you very much.
Thank you so much, Doctor. Many congratulations for the award.
Our next awardee is Dr. Sachin Somnath Balkunde, a COVID warrior from Rural Government Hospital, Latur. Congratulations, sir.
Thank you for selecting me. And basically, I'm working in the rural area of Latur district. And being a pediatrician, actually, we had cured lot of. We have cured more than 1,000 patients without costly medicine like remdesivir, tocilizumab, and ventilation. And that was possible because being in pediatrics, the few concepts like people keep treating COVID patients like an adult patient, like adult ARDS, but unlike that, I found this neurology concept to be very much useful in COVID. And we were able to treat more than 1,000 patients, around 1,200 to 1,500 patients around treated at very low cost and free of cost, almost free of cost. And thank you for selecting such a person like doctor like me from a rural area of India, and who was in remote place and out of your prime research institutes. And thank you so much to the team, and thank you.
Thank you so much, Doctor, and many congratulations for the award.
Thank you, madam.
Our next awardee is Dr. Sandhya Satish Karte, Dean Academic, Datta Mege Medical College, and Shalini Tai Mege Hospital, Wanadongri, Nagpur. Congratulations, Doctor.
Good evening, Asia GCC. It's really a great honor and privilege for me to be amongst you to receive this particular award. As such, for me, award is not a very new thing because this is my 36th award. And in fact, this came to me as a sudden nomination. I never applied for it, and hence I am really very honored to achieve this from you all. And I have got an experience of 32 years of working in various posts in government, private, as well as corporation sector. I have worked in all three categories, and I'm really honored that you have nominated me, you have selected me for this particular award, particularly along with Dr. Swati Bhave, who is my mentor, Dr. Pramod Jog, whom I have worked very closely, and all my colleagues, Sujata and Shailaja. We have all worked together for a very local cause, and it is I'm really, in fact, very much overwhelmed and delighted to receive this particular award, because this is something which came to me without having applied for any nomination. And I really feel so proud and thankful to you, and assure you that the award for which you have selected, I will carry out the good work throughout my life. Thank you so much.
Thank you so much, ma'am. Many congratulations for the award.
Thank you.
Our next awardee is Dr. Sudarshan Kumar Bhandari, a retired consultant from Newham University and Hospital, London. Congratulations, Doctor. Our next awardee is Dr. Umesh Khurana, Professor of Pediatrics, CCM Medical College, Chhattisgarh. Congratulations, Doctor.
Good evening, all. I take this opportunity to profusely thank Asia GCC and its jury for considering myself for this iconic Healthcare Leader Award in Pediatrics. Well, I have got around more than 40 years experience in pediatrics and had received fellowship in neonatology abroad. But that aside, I am really very much worried currently regarding the status of malnutrition in India as revealed by NFHS 5 database. I am a BPNI national trainer, IYCF trainer, and have innovated KMC bags, resuscitation trolley, phototherapy units, and am engaged in training of doctors, nurses, Anganwadi workers, especially in the tribal area of Chhattisgarh. So this recognition by your organization motivates me to work immensely to prevent malnutrition in India, and hence I dedicate this award very humbly to children of India. Thank you very much.
Our next awardee is Dr. Uday Kumar Sahu, pediatrician, Savitri Children's Clinic. Congratulations, sir. Our next awardee is Dr. B. Sasi Kumar, Associate Professor, SP Medical College, and Consultant Pediatrician at Sri Suraksha Hospital. Congratulations, sir.
Let me thank the organizing committee, especially Dr. Fareen Khan, for proposing to my name for this award, along with the stalwarts like Pramod Jog sir and Sara madam and Sailaja madam. Thank you, one and all. Thank you.
Our next awardee is Dr. N. Ravi Kumar, HOD and Professor of Pediatrics, Nilofar Hospital, Hyderabad. Congratulations, Doctor. Our next awardee is Dr. Bobby Sadavarthi, Pediatrician and Neonatal Intensivist, AIMS Hospital. Congratulations, Doctor. Our next awardee is Dr. Mohit Ajit More, Pediatrician, Varad Hospital, Devpur. Congratulations, sir. Our next awardee is Dr. Manohar Badur, Professor, Sri Venkateswara Medical College, Tirupati, Government of Andhra Pradesh. Congratulations, sir. Our next award category is Iconic Healthcare Leader Award, Pediatrics and Neonatology. And the award goes to Dr. Shilpa Umesh Kalane, Chief Neonatologist, Dinanath Mangeshkar Hospital, Pune. Congratulations, ma'am.
Good evening, everyone. I'm humbly thankful to the team who selected me qualified for this award. And it is an honor to share the platform with all the senior and my respected teachers. Dr. Khadse is there, Dr. Zog is there, and Dr. Shailaja Mane is there, Dr. Sujata Kaneri is there. So we worked all together for the neonatal care, for the improvement of neonatal care. And when it comes to the neonatology or any field related to pediatrics, it's a teamwork. This award is a recognition of our efforts to ensure patient safety, and it reaffirms the dedication and incredible teamwork required to provide excellent care to all the newborns. Thank you so much for this honor. Yes, ma'am.
Please make your video on.
Madam, I'm in car.
Okay. Then it's okay. Okay.
Yeah. So I don't know. Yeah. So even there could be a range issue also. So thank you so much.
Thank you so much, ma'am. Our next awardee is Dr. Jalil Mudawar, Senior Consultant Neonatologist and Pediatrician, and visiting neonatologist, Sahyadri Super Speciality Hospital and Others Nursing Home, Pune. Congratulations, sir. Our next award category is Women Healthcare Leader Award, Neonatology, and the award goes to Dr. Janisha Jain, Consultant Neonatologist, Kothram Hospital and Research Center, Indore. Congratulations, ma'am.
Good evening, everybody. At the outset, I would like to thank the organizers for choosing me, and I really feel honored and humbled for this award. I work as a neonatologist at Choithram Hospital, Indore, and it's just the beginning of my career, and I really feel honored for this award, and I dedicate this award to my team at NICU Choithram and to my family. Thank you so much.
Thank you so much, Dr. Many congratulations for the award.
Our next award category is Iconic Healthcare Leader Award, Pediatrics and Public Health. And the award goes to Dr. Chandrakant Laharia, Consultant Physician and Epidemiologist, Foundation for People-Centric Health Systems, New Delhi. Congratulations, sir. In my line, I have always learned to end the event with a positive thought. No matter how hard involves tomorrow is a fresh opportunity to make it better. At the end, every step must affect forever. Maybe I had to inspire some more stars next year. With this now, we come to an end of this award ceremony and today's webinar. May I request Dr. Fareem Khan to do closing remarks. Over to you, ma'am.
I thank to all the esteemed participants. It has been an honor to have you all present in our event. Your participation ensures the success of the event. Once again, I thank you everyone for all your kind support. I also like to thank Professor Syed for being such a wonderful host for the evening. I like to thank to our esteemed speaker, Dr. Shefali Gulati, for sharing her kind support to our organization. I also like to thank to our gold partner, the Energy Business Solution, and presenting partner, Pharma Global Management Services, CEO and co-founder, Mr. Azharuddin Farooqi, for all your support and the opportunity to work with him. Last but not the least, to all the participants and the award winner, wishing you all a many congratulations. Hope to invite you soon again. Thank you, everyone. Stay safe, stay healthy.
Thank you so much, ma'am.
Thank you. Thank you.